Hi, my name is Adriana Juarez. I'm a certified medical assistant with the NCCAA health staff. Today we'll be going over diapering and toileting, and you'll gain information regarding proper techniques in toileting, diapering, and the use of training pants. You'll be able to recognize the importance of assisting children with toileting, diapering, or the use of training pants, and understand the policies of staff, male or female, assisting male or female children with toileting, diapering, or changing training pants or underclothing. According to performance standards, the purpose is to maintain the health and safety of children by properly practicing sanitation and hygiene procedures and to prevent the spread of germs by cleaning and disinfecting diapering surfaces and bodies. We want to check diapers and training pants periodically for wetness or soiling to prevent skin irritations with the use of disposable gloves. Dispose of diapers or training pants in a disposable sealed trash bag and place in a covered lined trash can. An IHCP, or Individualized Healthcare Plan for Health, should be initiated and signed by the child's primary care physician and parent before powders, creams, ointments, or lotions may be applied. Staff must assist all children as necessary with diaper changing or changing of disposable training pants. All staff, males or females, must assist all male or female children with diapering, toileting needs to include removing wet, soiled clothes and placing clean and dry clothes. During toilet training, infant toddler staff must clean and disinfect toilets after each use. The diapering surface must be non-absorbent for effective disinfecting. Diapering tables must be sturdy, adult height, and equipped with safety rails to prevent the child from accidentally rolling off the changing table. Keep all diaper changing supplies out of reach of children. Let's go over the diapering procedures. In step 1, get organized. Before you bring the child to the diaper changing area, wash your hands. Gather the supplies you need and bring them to the diapering changing table, like fresh diapers, clean clothes, disposable wipes, plastic bag for any soiled clothes, creams or ointments if prescribed by the doctor, and put on your disposable gloves. In step 2, gently place the child on the diapering surface, always keeping a hand on the child. If an emergency arises, caregivers should place the child on the floor in a supervised area or take the child with them. If the child's feet cannot be kept out of the diaper or from contact with soiled skin during the changing process, remove the child's shoes and socks so the child does not contaminate these surfaces with stool or urine during the diaper changing. Put soiled clothes into a plastic bag and securely tie the plastic bag and send the soiled clothes home. In step 3, clean the child's diaper area. Unfasten the diaper, but leave the soiled diaper under the child. Remove stool and urine from front to back and use a fresh wipe each time. Put the soiled wipes into the soiled diaper or directly into a plastic bag and securely tie the bag. In step 4, remove the soiled diaper without contaminating any surface and place in a covered plastic-lined trash can. Remove the gloves used and place them into a plastic-lined covered trash can. Use a disposable wipe to clean the surfaces of the caregiver's hands and another to clean the child's hands. Place the wipes into the plastic-lined covered trash can. In step 5, put on a clean diaper and dress the child. Note and plan to report any skin problems such as redness, skin cracks, or bleeding. In step 6, wash the child's hands and return the child to a supervised area. Use soap and water at a sink to wash the child's hands. If a child cannot stand at the sink, use disposable wipes or wipe the child's hands with a paper towel with water and soap, then wipe clean with a wet towel, and then dry the child's hands with a dry paper towel. Toss the paper towel into a plastic lined covered trash can. In step 7, clean and disinfect the diaper changing surface. Clean the changing surface with soap and water, then rinse with water. Spray the changing surface with a disinfectant solution. For example, a disinfecting bleach solution of the household liquid chlorine bleach in tap water mixed fresh daily. Follow labeled directions on the bleach container on proper mixing ratios. The surface can be left to air dry or it can be wiped dry after allowed time suggested by the label of surface contact with the bleach solution. In step 8, wash your hands. Return cleaning and disinfecting solutions to its proper place and wash your hands again. Step 9, record the diaper change in the child's daily activity report and record what was in the diaper and any problems, such as a loose stool and an unusual odor, blood in the stool, or any skin irritation, and report as necessary. If the child is 18 months or older, utilize the diaper disposable training pants changing log as necessary. The daily activity report and the diaper disposable training pants changing log are submitted to your site-based manager. So just remember, a clean diaper, happy baby. So let's move on to toileting. Toileting. Children who are learning to use the toilet may still wet or soil their disposable training pants, underwear, and clothing. Changing these garments can lead to risk for spreading infection due to the contamination of surfaces from urine and feces. The procedure for changing a child's soiled undergarment and clothing is designed to reduce the contamination of surfaces that will later come in contact with uncontaminated surfaces such as hands, furnishings, and floors. Okay, steps to changing soiled items. Step 1, wash your hands, gather supplies for changing, and determine if the child will be lying down or standing. Step 2, avoid contact with soiled items. Remove clothing, shoes, and socks if necessary. Have child hold his or her shirt, sweater, or etc. up above the waist during change. If disposable training pants were used, pull sides apart rather than sliding down the child's legs. If using underwear, remove with clothing, doing your best to avoid contamination of surfaces. Do not rinse soiled clothing, place in a plastic bag, seal, and return to the parent to be cleaned at home. If shoes are soiled, the teacher or the caregiver must wash and sanitize them before putting them back on the child. A good idea would be to request a few extra socks and extra shoes from the parent to be kept at the facility. Step 3, clean child's skin and check for spills. Lift the child's legs as needed to use disposable wipes. Remove stool and urine from front to back and use a fresh wipe each time. Place soiled wipes into disposable training pants or directly into the plastic lined covered trash can. If gloves were used, remove using the proper technique and put them into a plastic lined covered trash can. In step 4, put on a clean disposable training pants or clean underwear and clothing if necessary. Assist the child as needed in putting on clean disposable training pants or underwear and then in redressing. In step 5, you want to wash the child's hands and return the child to a supervised area. In step 6, clean and disinfect the changing surface. That includes the changing pad. If clothing is soiled, securely tie the plastic bag used to store clothing and send bag home. Remove any visible soil from changing surface with a disposable paper towel saturated with water and soap and then rinse. Wet the entire changing surface with disinfectant that is appropriate for the surface material. Follow the manufacturer's instructions for use. Put away the disinfectant. And in step 7, perform hand hygiene according to proper procedures and record the change on the appropriate changing log. For Head Start, you would use the diaper disposable training pants change-in log and record any problems. For example, a loose stool, an unusual odor, blood in the stool, or any skin irritation, and report as necessary and submit the log to your site-based manager. So important things to remember: wash your hands, get organized, keep the child safe, wash the child's hands, clean and disinfect the areas, wash your hands again, and use the appropriate document to log the change. So this is a sample of the daily activity report. This will be used for infants that are 0 to 17 months. The site-based manager will need to keep this log for 3 consecutive months. So when it's been completed, please turn it into your site-based manager. This log is your diaper and disposable training pants changing log. This form is used for 18 months and older. This form will also be turned into your site-based manager. That will conclude my presentation on diapering and toileting. Let's go over the agenda. Question number 1. Male and female staff must assist all children with their toileting, diapering, and their training pants. True or false? That would be true. Question number 2. Children must be assisted with changing as quickly as possible. True or false? That would be true. And question number 3. Describe how you prepare the diapering area to ensure the child's safety. Gather supplies before changing the child. And the resources I used for this presentation would include the Head Start Program Performance Standards, Minimum Standards, and Caring for Our Children. Hope to see you soon. Stay safe. Thank you.